Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a doctor talking to a patient named Mrs. Anderson, who has been experiencing symptoms of heart disease. For questions 1 to 12, complete the notes with a word or short phrase that you hear.
Good morning, Mrs. Anderson. I understand you've been having some concerns about your heart. Can you tell me more about the symptoms you've been experiencing?
Yes, doctor. For the past few months, I've been feeling a bit short of breath, especially when I'm climbing stairs or walking for long periods.
I see. Have you noticed any chest pain or discomfort during these episodes?
Yes, sometimes I get a slight pain in my chest, but it usually goes away if I rest for a few minutes.
And how long have you been experiencing these symptoms?
It's been about 6 months now, but it's been getting worse in the last few weeks.
Okay. Based on what you've described, it sounds like you could be developing angina, which is caused by reduced blood flow to the heart. Have you had any other symptoms, such as dizziness or fainting?
No, I haven't fainted, but I do feel lightheaded sometimes.
All right, we'll run some tests to confirm the diagnosis. In the meantime, I recommend you avoid any strenuous activities and take it easy.
Extract 2. Questions 13 to 24. You hear a pediatrician discussing a case with the mother of a 4-year-old boy, Ethan, who has been experiencing recurring ear infections. For questions 13 to 24, complete the notes with a word or short phrase that you hear.
Good afternoon, Mrs. Thompson. I see that Ethan has been having some issues with his ears lately. Can you tell me more about his symptoms?
Yes, doctor. He's had about 3 ear infections in the last 2 months. His ears seem to bother him a lot, and sometimes he pulls on them when he's upset.
That's concerning. Does he have any trouble hearing, or does he seem to react to sounds differently?
Yes. Sometimes I notice he doesn't respond when I call his name, especially if I'm behind him.
I see. Has he had any fever or drainage from his ears during these infections?
He had a mild fever with the first infection, but not with the others. There hasn't been any drainage.
All right. It sounds like Ethan might have fluid buildup in his ears, which could explain the recurring infections and his trouble hearing. We'll need to perform a hearing test and possibly refer him to an ENT specialist.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you will hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer, a B or C, which fits best according to what you hear. Question 25. You hear a doctor briefing a nurse about a patient who recently underwent surgery.
The patient in room 302 had surgery on his left knee yesterday. He's doing well, but we need to watch for signs of infection. Make sure you check his wound every 4 hours.
Got it, doctor. Should I also monitor his temperature?
Yes, that's important. Any significant increase could be a sign of infection, so let me know if his temperature goes above 38 degrees Celsius.
Question 26. You hear two pharmacists discussing a patient's prescription for high blood pressure medication.
I just checked Mr. Anderson's prescription. The doctor's prescribed a higher dose of his blood pressure medication.
Is that safe for him? He's had some side effects from the lower dose already.
That's true, but his blood pressure hasn't been responding well, so the doctor is trying to manage it more aggressively. We'll need to keep an eye on him.
Question 27. You hear a pharmacist discussing a patient's medication plan with a general practitioner.
I noticed that Mrs. Brown is on two medications that could potentially interact. Both her blood pressure medication and her cholesterol medication can increase the risk of muscle pain.
That's a good catch. We should consider adjusting her dosage or switching her to a different medication.
Question 28. You hear two physiotherapists discussing a patient's progress with rehabilitation after surgery.
How is Mrs. Brown doing with her post-op exercises?
She's making good progress, but she's still hesitant to put full weight on her leg. I think she's afraid of re-injury.
That's understandable. We need to encourage her to gradually increase her activity, or she might not regain full mobility.
Question 29. You hear a dentist instructing a dental assistant on how to prepare for an upcoming procedure.
For the next patient, we'll be doing a tooth extraction. Make sure all the instruments are properly sterilized and ready before the procedure starts.
Should I also prepare the anesthesia?
Yes, get that ready as well, but be careful to double-check the dosage. We don't want any mistakes.
Question 30. You hear an oncologist discussing a treatment plan with a nurse for a patient undergoing chemotherapy.
Mrs. Jones has had 3 cycles of chemotherapy, and her blood tests show a drop in her white blood cell count. We need to monitor her closely for any signs of infection.
Should we consider delaying her next cycle of chemotherapy?
That's a possibility if her counts don't improve. We'll recheck in a few days and decide then.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear a presentation by a dermatologist about the rise of skin cancer and the importance of early detection.
Good afternoon, everyone. Today, I'll be discussing the increasing incidence of skin cancer and the crucial role early detection plays in successful treatment outcomes. Over the past few decades, we've seen a significant rise in skin cancer cases, particularly melanoma, which is the most dangerous form. The main risk factors include excessive exposure to ultraviolet UV radiation, either from the sun or tanning beds, and having a family history of the disease. Early detection is vital because the chances of curing skin cancer are much higher if it's caught early. This is why regular skin checks, either at home or by a dermatologist, are so important. We recommend that patients look for changes in the size, shape, or color of moles, as these could be signs of melanoma. One useful method is the absidy rule: A for asymmetry, B for border irregularity, C for color variation, D for diameter, and E for evolving. If any of these characteristics are present, it's important to consult a healthcare professional immediately. Another crucial point is prevention. People should protect themselves from UV radiation by wearing sunscreen with at least SPF 30, seeking shade when the sun is at its peak, and wearing protective clothing, including hats and sunglasses. These simple measures can significantly reduce the risk of skin cancer. In conclusion, Awareness and vigilance are key in combating skin cancer. Early detection and prevention are our best tools for reducing its impact.
Extract 2. Questions 37 to 42. You hear an interview with Dr. Emma Collins, a neurologist, about her research on migraine headaches and their impact on patients' daily lives.
Thank you for joining us today, Dr. Collins. Could you start by explaining how your research is helping us understand migraines better?
Certainly. Migraines are a complex neurological disorder that affects millions of people worldwide. What makes migraines particularly challenging is that they don't just involve headaches, they can also cause nausea, sensitivity to light, and even visual disturbances, which can severely impact a person's quality of life. Our research focuses on identifying the triggers that cause migraines and understanding the biological mechanisms behind them.
That sounds fascinating. Can you tell us about some of the common triggers you've identified?
Of course. Some common triggers include stress, lack of sleep, hormonal changes, certain foods like chocolate and caffeine, and even environmental factors such as bright lights or loud noises. However, triggers can vary greatly from person to person, which is why we encourage patients to keep a migraine diary to help identify their personal triggers.
And what about treatment? Have there been any advancements in how we treat migraines?
Yes, there have been significant advancements in migraine treatment.
In addition to traditional medications, we now have new options like Botox injections and CGRP inhibitors, which are specifically designed to prevent migraines. It's an exciting time in migraine research, and we're hopeful that these new treatments will provide relief to many patients.
That is the end of the listening test. You now have 2 minutes to check your answers.
AVN Pharma Education.